everyone. It's my great honor to be here to have my presentation this afternoon. I'm Dr. Shaolin Hong from Beijing, China. So the topic today, I will talk about salicylic acid peel combining with non-ablative fractional laser, the case study for acne therapy. So it's acne pathogenesis. Actually, acne is a very common disorder in the age of 20s, 30s, or even 40s. Right now, in my clinic, some patients at the 40s years age still have acne problem. So the pathogenesis come from hormones, cosmetics, bacterial infection, corneal embolization, system disease. So at a different stage of this disease, we have different clinical manifestation. Like the early stage, we have pimple, we have papule, pustule, and late stage, maybe you have nodule, cysts, and scars. So at the scars, we have atrophic or hypertrophic scars. So the goal of acne treatment for skin resurfacing, we want to decrease inflammation, to fewer comedones, papules, and pustules and cysts, to minimize pore size and scars, to stimulate epidermal and dermal repair, and to decrease and correct PIH. It's a post-inflammatory hyperpigmentation. So right now we have different strategies for acne therapy, like blue red light, PDT, chemical peel, IPL, non-ablative or ablative lasers, and radio frequency microneedling. Depends on different clinical features like oil skin, enlarged pores, PIH, or scars or inflammatory lesions. We have different choice. For example, for oil skin, we can choose blue-red light. We can choose chemical peel. We can have IPL and non-ablative lasers. For enlarged pores, we usually choose IPL, non-ablative or ablative lasers, and radio frequency microneedling. For PIH, we choose chemical peel, IPL, non-ablative, and ablative laser. And for inflammatory lesions, we can choose blue red light, PDT, chemical peel, IPL, and non-ablative, for example. And for erythematous lesions, we also can have IPL, non-ablative, and radio frequency treatment models. Okay, so this picture shows the energy device work on the skin. For example, non-ablative tissue heating, for ablative resurfacing, and very superficial fractional ablative resurfacing. Usually these lasers come from CO2 or ammoniac. Okay, so we also have non-ablative and ablative fractional resurfacing laser. So these two lasers can work deep into the dermis, usually 600 to 1000 microns. So we want to use non-ablative laser because it has advantage like minimal downtime and penetrate deep into dermis. Okay. So in the market right now, we have different brands for non-ablative fractional laser like Paloma, Fraxel, M22, CNB, right now in China market, I mean. Okay, and the laser can hit dermal target to induce subclinical wound to stimulate healing while cooling the epidermis. So we require multiple treatment to provide no epidermal change. So it is very effective for deeper scarring. So you want to enhance the treatment results to use different procedures to affect the epidermis and dermis separately. We want to perform the procedures on the same day to get a better patient's compliance. So it's non-ablative resurfacing and chemical peels. So what kind of chemical peels we want to combine with non-ablative fractional laser? Our purpose is to reduce redness or edema, to inhibit the inflammation reaction, to prevent PIH, to diminish burning and pain. So salicylic acid peel actually is a very common clinical procedure. So The acid comes from willows. Its pharmacology action includes anti-inflammation, antibacterial, keratolytic, and comedolytic. Okay, at the lower concentration, like 1 to 4%, it helps keratosis normalization, and at a higher concentration, like 5% or higher, it can help keratolysis. So the agent is lipophilic, which can dip into follicular. So the purpose of the study is to, because salicylic acid peel and non-ablative fractional laser have both shown beneficial results on acne and breakouts. So we want to evaluate the efficacy and the safety of combining 1540 non-ablative fractional laser and sustained release SAPO for the treatment of mild to moderate inflammatory acne lesions. So we design 1540 non-ablative fractional laser treatment 3 times at 4 weeks interval. So immediately after laser therapy, they were applied with 30% sustained release SAPO, up to 5 to 10 minutes each time. Okay, SAPO was applied every 2 weeks. Totally, we have 5 treatments. So the laser fluence used is 38 to 40 microjoule and 320 microbiome. So it depends on the fractional density at 2 to 4 passes, depending on the treatment mode. At each treatment point, total acne counts were recorded for comparison. So 5-point GAI from 0, non-improvement, to 4, significant improvement. So 5 Chinese subjects is 1 male and 4 female. The mean age is 30 years old, and physiologic skin type is 2 to 3. 5 subjects with inflammatory acne papule and pustules, and 4 patients has PIH and 1 has acne scar. So 2 subjects has only 3 visits. So the results, 4 patients showed moderate to significantly improvement. The total acne inflammatory lesion reduction was 80% after 8 weeks, and overall patient PIH had lessened under UV observation. So post-procedure events, there's no reports of PIH or other adverse events. So very short time post events like redness or edema for a couple hours to a couple days. So this is a photo showed the patients the before, in the middle, and after of treatment. This is overview photo to show the skin situation. Case 1 is a female patient, is 22 years old. She finished 5 treatments. So this is the polarized light to show the dilated vessel and the redness and inflammatory reaction of the skin. So this is before, in the middle, and after. So this is the UV light show of the pigmentation problem before, in the middle, and after. We can see that the pigmentation problem actually it is a good result. This is another case. Is a female patient, is 33 years old. She finished 5 treatments. Is overview photo. This is a polarized light for the vessel and the inflammatory reaction and the redness, and this is the UV light to show the pigmentation. This is another case, is a male patient with 30 years old. We want to have a look of the patients for the laser with or without chemical peel. So for this patient, we have a comparison from both the left side to right side. For the left side is laser combined with chemical peel. For the right side, so it only has laser treatment. So in the middle photo, you can see the immediate effect after treatment. We can see that if the laser combined with chemical peel, the redness, the inflammatory reaction is very small, is okay, is a slightly reaction, but without chemical peel, the edema inflammatory reaction is heavy. Okay, so this is the also this is the photo shows the redness and edema. So and this is UV light show. Okay, demographic of study participants, complete studies. So we have 5 patients with inflammatory acne, papules, and pustules. We have the patients, 4 patients has PIH, and 1 has acne scar. Treatment visits, 3 patients have 5 treatment, and 2 patients have 3 treatment. So the acne accounts decrease a lot. So before and after, you can see the obviously reduction of acne accounts. The effect of the study participant, we can see the GAI score decrease 1 to 2 score, and the improvement, 3 patients have significantly improvement, and 1 has moderate and 1 has slight improvement. So discussion. The non-ablative fractional laser can decrease the sebaceous gland size to improvement in skin texture and sebum production, and risk to develop PIH. It depends on skin type and laser device. Energy and density setting is very rare happen. The light device therapy sometimes has short of anti-inflammation. So the dilated vessel is not equal to inflammation reaction. So we have, okay, so we have some options of choice like OPT, IPL, good for vessel dilation, but that cannot control inflammation control. Okay, so we want to combine with chemical peel, superficial chemical peel to decrease the inflammation. We have some choice of chemical peels from Jessina to resorcinol to AHA to BHA. And gradually, the inflammation reaction gradually decrease. So BHA inhibit inflammatory reaction to reduce skin sensitivity and PIH. So this is a review of as a first line BHA for the comedones and the acne, especially for the comedone lesions and mild to moderate acne lesions. So challenge for SA, because salicylic acid has a very low pH value. So the pKa value is 2.97, so it can irritate skin, induce itching, pain, and burning. So sometimes some products add sodium hydroxide to balance pH, that induce a decreased effect. So we add new products which has a 30% sustained release SA. So basically this product is a hydrogel base encapsulated with SA together, and the hydrogel can release the salicylic acid gradually, slowly, and can sustain the result, the effect 8 to 12 hours. There is no alcohol, no sodium hydroxide added, and the lower irritation for the patient's skin. So post-operation events is redness, dryness, peeling, and pimple prone. Usually we apply moisturizer to patients, so to help dryness. So we want to have a laser treatment and a BHA in the same session. So BHA used immediately after laser to reduce the inflammation and to smooth the skin. 2 peels performed monthly for 3 months, and the non-ablative laser to 3 times treatment every month for 1 time treatment. So you can allow 4 weeks interval. So conclusion, we combine SAPU and 1540 nanometer non-ablative fractional laser for both dermal and epidermal renewal to improve adult acne outcomes, to optimal clinical safety and efficacy, to minimize post-procedure downtime, to enhance patients' compliance and satisfaction, to reduce skin irritation and inflammatory inflammation quickly, to control pimple, comedor, PRH, minimize post-procedure side events in one visit. So I have no conflict of interest. Thank you.